really excited about the role of imaging in plastic surgery today. Because of phones, because of all the photos and the way we're looking at ourselves centrally, there's a big emphasis on what I call centrofacial appearance. Lips, brows, noses, eyes, cheeks. Now we can show patients in 360 what they look like so that we don't overemphasize just what we see when we're looking down at a photo of ourselves. But the real reason why imaging is so good today is that it allows patients to really see not only what they look like now, but what they will look like in the future. And it diminishes their anxiety or their leap of faith in terms of what's going to happen. The resistance to imaging has always been that people were concerned about an implied result, an implied guarantee. This is what I'm going to tell you you're going to look like. As we get better in our procedures and as imaging gets better, I feel much more comfortable that we can do that. And it's amazing that we've taken imaging from 17 years ago when we were just doing noses to the entire face. Every consult that I have regarding breast surgery includes imaging. Imaging for the breast not only helps describe volume, but it accurately shows shape and dimension and proportion as well. And when you do 360 imaging, if you're coming in for a tummy tuck, but you're really not happy with what's going on in the back, we can talk about that as well.